NCLEX RN Next Gen Practice Questions Free. Question 1. Set 1. A patient is post-bronchoscopy. What is the nurse's priority assessment? Pain level, gag reflex, urinary output, blood pressure. The gag reflex must return before the patient can safely eat or drink to prevent aspiration. Question 2. Set 2. At what age should a child be able to sit unsupported? 4 months, 6 months, 9 months, 12 months. Most infants can sit unsupported by 6 to 8 months. Question 3. Set 3. What is the antidote for heparin overdose? Vitamin K, protamine sulfate, naloxone, acetylcysteine. Protamine sulfate neutralizes the effects of heparin. Question 4. Set 4. A pregnant woman is at 32 weeks gestation. Which signs should she report immediately? Leg cramps, blurred vision or headache, backache, frequent urination. Blurred vision and headaches are signs of preeclampsia. Question 5. Set 5. What is the priority when a patient falls? Complete an incident report, notify the physician, assess the patient for injury, move the patient back to bed. Assessment of the patient's condition is always the first priority after a fall. Question 6. Set 6. A patient with DKA has small respirations. What is the physiological reason for this? To retain oxygen, to blow off CO2 and correct metabolic acidosis, to decrease blood pressure, to increase intracranial pressure. Small respirations are deep and rapid to compensate for acidosis by removing CO2. Question 7. Set 7. What is the significance of the TNM staging system? To determine the cause of cancer, to classify the extent and spread of the tumor, to measure the effectiveness of chemotherapy, to identify genetic markers. TNM stands for tumor size, node involvement, and metastasis. Question 8. Set 8. Which type of immunity is gained after receiving a vaccine? Natural active, artificial active, natural passive, artificial passive. Artificial active immunity results from vaccination. Question 9. Set 9. Which breath sound is commonly heard in a patient with an acute asthma attack? Crackles, wheezing, rhonchi, pleural friction rub. Wheezing is caused by air passing through narrowed airways. Question 10. Set 10. A patient with heart failure is prescribed digoxin. Which finding should the nurse report immediately? Heart rate of 72 bpm, visual disturbances like seeing yellow halos, increased urine output, blood pressure of 120/80 mmHg. Yellow halos are a classic sign of digoxin toxicity. Question 11. Set 11. What is the purpose of administering magnesium sulfate to a preeclamptic patient? To lower blood pressure, to prevent seizures, to induce labor, to increase fetal lung maturity. Magnesium sulfate is the drug of choice for seizure prophylaxis in preeclampsia/eclampsia. Question 12. Set 12. A patient is experiencing an acute manic episode. What is the priority? Involving them in group therapy, providing a high-calorie, finger food diet, teaching coping skills, encouraging social interaction. Manic patients have high energy and may not sit for meals. Finger foods provide necessary nutrition while on the move. Question 13. Set 13. A patient is receiving vancomycin. The nurse notes redness on the face and neck. What should the nurse do? Stop the infusion immediately, slow the infusion rate, administer epinephrine, document as a normal finding. Red man syndrome is often caused by rapid infusion of vancomycin. Slowing the rate usually resolves it. Question 14. Set 14. Which fetal heart rate pattern is most concerning? Early decelerations, late decelerations, accelerations, moderate variability. Late decelerations indicate uteroplacental insufficiency and are non-reassuring. Question 15. Set 15. What is a classic sign of appendicitis? Left upper quadrant pain, rebound tenderness at McBurney's point, pain relieved by eating, hemoptysis. Pain in the right lower quadrant with rebound tenderness, McBurney's point, is classic for appendicitis. Question 16. Set 16, which is the correct order of the nursing process? Planning, assessment, diagnosis, implementation, evaluation. Assessment, diagnosis, planning, implementation, evaluation. Diagnosis, assessment, implementation, planning, evaluation. Evaluation, implementation, planning, diagnosis, assessment. ADPI assessment, diagnosis, planning, implementation, evaluation. Question 17. Set 17. What is the golden hour in newborn care? The first hour after birth for skin-to-skin and bonding, the first hour of active labor, the first hour of the second stage, the hour before discharge. The first hour after birth is critical for bonding and initiating breastfeeding. Question 18. Set 18. A child is admitted with tetralogy of Fallot. Which position helps during a TET spell? Supine, knee chest position, prone, side lying. Knee chest position increases systemic vascular resistance and improves oxygenation during cyanotic spells. Question 19. Set 19. Which sign is a hallmark of pyloric stenosis in infants? Green diarrhea, projectile vomiting, steatorrhea, abdominal distension. Projectile vomiting after feeding is the classic sign of pyloric stenosis. Question 20. Set 20. What is the primary purpose of pursed lip breathing? To increase heart rate, to keep airways open longer and promote CO2 excretion, to decrease oxygen consumption, to strengthen the diaphragm. Pursed lip breathing prevents airway collapse during expiration.